This is not a school district issue. This is a statewide issue, that the governor wanted his powers in order to be nimble. And I have seen nothing nimble coming out of the State Department of Education or the governor's office to address the most important segment of our population, that being our children. It certainly has been a much-needed proposal that many of our caucus members, the House Republicans, have written letters to the State Department expressing the concern for the amount of school days that our children have lost this year alone due to the forced quarantining of very healthy children.
And a few weeks ago, after hearing several complaints or concerns from parents, teachers, students, and even school nurses about these quarantine procedures, the House Republicans collaboratively started working to encourage DPH and SDE to take a look at what other states were doing. Specifically to date, the state of Massachusetts has saved 50,000 in-person learning days for their students with the test and stay methods that they implemented on August 30th until now. It's important to note, too, that they've done something like 49,000 tests, and all but 500 have come back negative, proving that they can safely keep their kids in school. So down in Stonington and North Stonington, since the start of school, we account for 2,000 in-person learning days. And that's just one out of 151 House districts. So you can imagine the hundreds of thousands of in-person learning days that have been lost in this state to date.
But one of my concerns, my takeaway today, is the lack of data that SDE has collected. They don't really understand the quarantine impacts, and quite frankly, if they didn't receive letters from our caucus, I'm not sure to the depth and understanding that they would have had of this issue.
The numbers are shocking, and SDE is not tracking absences for COVID quarantines. In my district alone, and I have Cromwell and Portland, I've reached out to both superintendents. The state is requiring these superintendents to keep astronomical numbers of students away from their kids and away from in-class learning. In Cromwell alone, there were close to 500 kids who were forced to quarantine. In Portland, just over 300. The percentage of those kids that tested positive was small. Each of those kids lost, on average, just over 5 days of in-class learning. Talk to a parent, talk to a kid who's been forced to miss their friends, their teachers, and is scared to go back to school because they know that they're a bit behind. It is disappointing and should be a bit embarrassing that SDE doesn't have those numbers and that we're having this conversation in November and not of June of last year.
Just today, on my way here, I got a text message from a parent whose fourth grader just got quarantined for 10 days for the third time since August 25th. I think we need to realize that our students are going to compete nationally for colleges, in the workforce, and if we're going to create, we have to be careful not to create a competitive disadvantage to them with the achievement gap that we're creating in this state. So in addition to the students, I've also had single moms on the phone in tears because they have to go to work and their second or third grader is now quarantined again. And employers are just not giving folks these days off anymore. So it's putting a tremendous amount of stress on working families, single parents, etc. And
community spread is not evidence. Despite the Delta variant hitting all of our communities and around the country, Connecticut has remained stable. And in the beginning, this was all about not overrunning our hospitals. And one of the most restricted areas yet today still are our schools. And we could argue that, fine, the children are not vaccinated, but it was a little bit disturbing to me that the Commissioner of Public Health had made the reference that, well, schools are the place that we have the most control over. That shouldn't be the metric dictating what policies we put forth. And so today I think it was an important measure to allow the Screen to Stay program. But the second part of this equation that the state needs to answer for our districts are, how are we going to get these children educated who are forced to quarantine at home? Because it's still going to happen. There is no plan in place for instruction for children that have to quarantine. And so I think that it is incumbent upon us in the Department of Education to put together a rapid response team that has all the stakeholders, including the legislature, involved, including our teachers, including our parents, to begin to figure out how we are going to get this right. Connecticut is not leading on education like we usually do. We're following, as you heard from the governor today, states like Arizona, North Carolina, and Massachusetts, who have put these policies in place well into August. And when the question was, which I'm also confused about, is we have a mandate of vaccination for our state employees, or you need to test every week. And now we're going to a screening policy for children that are asymptomatic, and it doesn't seem to follow the data or the science. Part of the reason, as we heard, was there was no plan in place. They didn't put a test to stay in place like Massachusetts did, which took a number of months. And the fact that that wasn't done to begin with, we're now sort of putting a reactive stopgap into place as a result of letters that were written from House Republicans demanding a change to the quarantine policy.
Largely, the answer is that these kids are being sent home for 10 days. They're given work to work on and then figure it out. And keep in mind that most of these kids are elementary level because, as Vinny pointed out, we have high vaccination rates in our high schools and kids over 12. So this is happening generally at the elementary school level. And I think it's important to note, too, that parents in this state, if you decide to take your child on a vacation outside of the school vacation days, you get a notice from the principal telling you how you shouldn't be doing that, and it's important that kids are in school. And yet we're ignoring, up until now, great data from a neighboring state that can keep our kids exactly where we think they need to be in school learning.
They also could have followed Massachusetts in their online learning platform that they had last year that our caucus has been pushing for the state of Connecticut to implement, which this pandemic will be certainly over by the time the state gets around to implementing that policy. So, there are other alternatives. And I would also say that the CDC guidelines of quarantining children create a significant problem in our schools in that the way our statutes are written, children historically would miss school because they're either sick or they're suspended. Our laws say that if a child is out of school for less than 10 days, the school has no obligation to sort of give them extra tutorial help. And so what's happened is that the protocols that are being followed is a 10-day quarantine that under state law, none of our districts are obligated to give these children additional help. And so it would have behooved this governor to change that statute if he wanted these nimble emergency powers back on September 1st to make sure that those children who are forced quarantined would have had some heightened level of educational support as they have to sit home, especially at the state of Connecticut at the town level and the state level have gotten millions and billions of dollars to mitigate this pandemic. And instead, what our governor has done is it's been press conference after press conference announcing a new program. But what isn't being talked about is how is that program being rolled out and what are the outcomes that we're achieving by that program? Totally. I mean, I hear, number one, about kids that are quarantined, that they don't have the necessary tutors to help bring them back to school. I hear from our principals and teachers of the emotional impacts that children have been having. I don't think the mental health support is there for the kids. There are behavioral issues that we haven't, seen at this level that I think need to be addressed. And I think the state needs to be looking at all of that holistically. I also think we continue to need to monitor language acquisition, socialization behavior for children, especially pre-K through third grade, and the impacts that the masks are having on them, which we don't talk about. But if you look at Europe, they do not mask children under the age of 12 because they're concerned with language acquisition. In talking to teachers around my neck of the woods, they're looking to go to clear face shields because they are finding that children are having issues with phonics and pronunciation, and they are concerned that it is impacted by the mask wearing. These discussions need to start happening. We no longer need to live in a state of fear. We have information. We need to utilize that information and put best practices in place for our children.